Welcome to Person-Centered Options Counseling Certification, Introduction and Implementation. This overview is being presented by the Center on Aging and Community Living in partnership with the New Hampshire Department of Health and Human Services. Our goals for today are to review the process for Person-Centered Options Counseling Certification in New Hampshire. We're also going to discuss the 4 components that make up Person-Centered Options Counseling Certification: online training, in-person training, mentoring, and the creation of a written portfolio. We will talk about how these components support each other, how they align with state and federal standards, and how you can use them to complete the certification process. It will be helpful to use the booklet New Hampshire No Wrong Door Person-Centered Counseling Certification during this presentation. To reach our goals of understanding the certification process and the 4 components for certification, we will define timelines, roles for staff, and share tools and documents. This graphic outlines the 4 components of Person-Centered Options Counseling Certification: the federal online modules, a 1-day in-person course, mentoring, and a written portfolio. The first component we're going to talk about is the online training portion of certification, the federal online modules. The federal online modules were developed by the Administration on Community Living. The models cover many different topics, including protection and advocacy, person-centered thinking, an introduction to the No Wrong Door system of access, and more. Supervisors assist in identifying which modules each staff member must complete based on their job functions. Module completion is tracked by supervisors. Staff who are seeking PCOC certification, or Person-Centered Options Counseling certification, are required to complete all of the online modules. Staff must receive an 80% passing grade or better on the quiz at the end of each lesson in order to qualify for certification. Please note, Global Module 1 of the federal online modules must be completed before attending the in-person training component. This includes Introduction to No Wrong Door System, Lessons 1 through 4, and Person-Centered Thinking, Lessons 1 through 12. After the in-person training is completed, all other modules can be taken at any time during the certification process and in any order. The next component of certification is the 1-day in-person course. This course gives certification candidates the opportunity to put learning into practice. Since candidates will have taken Global Module 1 from the federal online modules, candidates will have a basic knowledge of person-centered options counseling. This 1-day course will support candidates in practicing the skills they've attained in preparation for the rest of the certification process. This training focuses specifically on the skills needed to deliver options counseling to an individual or family. Skills and practices covered in the 1-day course include identifying options in a person-centered way based on the urgency of an individual's needs, assisting individuals and families with prioritizing options, and how to explain programs, services, and available supports. Trainers must be from an organization approved by New Hampshire's Department of Health and Human Services. Next, we will discuss mentoring within the New Hampshire Person-Centered Options Counseling certification process. When a staff member decides to pursue Person-Centered Options Counseling certification, their supervisor will connect the candidate with a mentor. The mentor will work with the candidate throughout the certification process. Mentors are experienced and certified person-centered options counseling professionals. Mentors should be open to working with others, comfortable with consulting with candidates, and have an in-depth understanding of what it's like to put person-centered options counseling into practice. Mentors can be outside of the candidate's organization, but must be person-centered options counseling certified. Mentors are responsible for communicating with candidates on at least a biweekly basis and are required to work with candidates and supervisors to identify potential shadowing experiences for the candidates during the certification process. We will discuss shadowing opportunities more later in this presentation. In order to become a mentor, a certified person-centered options counseling professional should meet with their supervisor. Supervisors and mentor candidates should discuss the criteria for mentorship and identify any additional training needs the mentor candidate may have. Mentor candidates should update their written portfolio accordingly and send the request for mentorship approval to the review board for consideration. The review board will be discussed later in this presentation. The creation of a written portfolio provides person-centered options counseling certification candidates with the opportunity to demonstrate the knowledge they've gained through participating in the approved person-centered options counseling curriculum. The purpose of the portfolio is to generate feedback and skill assessment while demonstrating that the candidate's skill set reaches the appropriate level for certification. All materials included in the candidate's portfolio will be generated during one-on-one shadowing experiences with the candidate's assigned mentor. Candidates will record their experiences and observations through process recordings. Candidates will shadow their mentors for a total of 15 hours, or the equivalent of 2 full working days, and will record their experiences and observations through process recordings. Partway through the shadowing process, candidates will take the lead in providing person-centered options counseling to a client with the mentor present. Shadowing experiences and timing are determined by the mentor, supervisor, and candidate. The No Wrong Door system of access competency framework should be used to support shadowing experiences. Staff will be expected to demonstrate interviewing, listening, and other skills by participating in intensive review discussions with mentors after shadowing experiences have taken place. Candidates will be expected to utilize person-centered counseling tools during their training process. Portfolios must contain a minimum of 4 examples of the use of tools. Tools must support the demonstration of the candidate's understanding of preference identification and goal setting. Process recordings are a detailed narration of what occurs during each shadowing event. Process recordings are meant to be shared with both mentors and supervisors. Mentors and supervisors are expected to offer meaningful feedback, preferably in writing, on the process recording form. It is expected that candidates, mentors, and supervisors will work out a regular routine for sharing and the return of process recordings to support the candidate's certification process and any established schedule. Process recordings should be saved and inserted into the candidate's portfolio. A template to support process recordings is located within the New Hampshire Person-Centered Options Counseling Guidebook. The federal government, through the Administration on Community Living, has designated their own certification level. This is called Federal Person-Centered Certification. The Federal Person-Centered Certification includes all of the federal online modules, Global Modules 1, 2A, and 2B, and attending the in-person options counseling course. Staff within the No Wrong Door system may only require the federal level of certification based on their job functions, while others will need to complete the full New Hampshire Person-Centered Options Counseling certification. New Hampshire Person-Centered Options Counseling certification encompasses the federal person-centered certification components while adding additional components to meet New Hampshire's high standards for person-centered care delivery. We've discussed the 4 components of New Hampshire's person-centered options counseling certification: the federal modules, a 1-day in-person course, mentoring, and the written portfolio. Now we will discuss the actual process for submitting for certification approval. The candidate, the candidate's mentor, and the acting supervisor should work towards agreement that the candidate's portfolio is ready for review by the New Hampshire CarePath Certification Review Board. Once this consensus is achieved, the portfolio and required training documentation will be submitted to the New Hampshire CarePath Certification Review Board for approval. This volunteer board, made up of experienced person-centered options counseling staff, mentors, supervisors, and other No Wrong Door professionals, convenes when requested to evaluate and approve person-centered options counseling certifications. Supervisors and candidates should work together to identify and ask volunteers from the approved list of New Hampshire CarePath Review Board members to review and approve a candidate's portfolio. If a candidate is identified as requiring additional skill development, mentors and supervisors will recommend to the candidate areas for improvement or added experience needed before certification can be awarded. The candidate's supervisor would then work closely with the candidate to formulate and execute a plan to provide the candidate with the added experience. The No Wrong Door competency framework would serve as a guide for this process. Once candidates have successfully completed additional tasks, they can resubmit for certification. Person-centered options counseling certified staff can maintain certification by completing 2 continuing educational opportunities per year. Person-centered options counseling staff should work with their supervisors to determine the best available learning opportunities. The No Wrong Door competency framework will assist in this process. Person-centered options counseling mentors are selected for mentorship through the process previously discussed. Approval for mentorship comes from the review board, and mentors can become recertified in person-centered options counseling automatically by serving as a mentor. On this slide, you'll see an example of the competency framework competency self-assessment. The No Wrong Door competency framework is a vital tool to help guide the New Hampshire person-centered options counseling process. Candidates should use the No Wrong Door System of Access competency framework to understand and assess proficiency in competency areas and to identify areas for future learning opportunities in consultation with mentors and supervisors. Mentors should use the competency framework to support discussions with a candidate, to encourage the candidate to think critically about his or her future learning opportunities, and as a framework for assessing readiness for certification. Supervisors can use the competency framework as an assessment to support a candidate with additional learning opportunities, to support a candidate's self-assessment of readiness for certification, and in supporting the achievement of competencies through professional duties and scope of work. Next, we will go over some examples of what a timeline for certification may look like. There are no specific timelines for certification. The process is flexible and should be individualized for the candidate. Any timeline should be based on workflow, training opportunities and availability, and a candidate's unique circumstances. Here is a sample timeline for person-centered options counseling candidates. This timeline can be found in the New Hampshire No Wrong Door Person-Centered Options Counseling Certification booklet. Next, we will discuss 3 example timelines. One for a candidate seeking federal certification, one for a candidate seeking New Hampshire Person-Centered Options Counseling certification, and for a certified professional options counseling professional applying to become a mentor. First, we'll discuss Tricia, who's looking to achieve the federal certification. Tricia is a new hire and is being trained as an information and referral specialist. She's interested in person-centered approaches, behavioral health issues, and substance use treatment. She has no formal prior experience. Here's what a timeline may look like for Tricia. During her first 3 months of employment, she would complete online Module 1 while receiving other required training for her new role. Then, she would complete the in-person course Global Modules 2A and 2B. This process may take more or less than a year, depending on when the in-person course is offered and what other training she's required to take in order to complete her position duties. Steve would like to complete Person-Centered Options Counseling certification. Steve has extensive experience, has been trained in a variety of areas, and is looking to formalize his trainings by achieving Person-Centered Options Counseling certification. Here's Steve's timeline. Like Tricia, Steve completes Global Module 1 during the first 3 months of his certification timeline. He also meets with his supervisor and is connected to his mentor so that he can schedule his shadowing experiences and so that he, his mentor, and his supervisor can identify what shadowing experiences would be the most meaningful and educational for Steve. During month 4, Steve continues his online coursework and takes the 1-day in-person training. Steve's online coursework continues as he completes his 15 hours of required shadowing experiences. Samantha is an experienced person-centered options counseling certification holder and would like to become a mentor. She has experience as a long-term support counselor. She became certified in New Hampshire's person-centered options counseling last year. She enjoys working with others and is patient and is passionate about person-centered approaches. Here's Samantha's timeline. We can see that she meets with her supervisor about her desire to become a mentor. During this time, she also reviews her completed and approved certification portfolio and makes sure she has the documented training experiences required to keep her person-centered options counseling certification current and active. Once Samantha has collected this and reviewed this information with her supervisor, her review board is contacted and her request for mentorship approval is submitted. We hope this presentation has given you a clear understanding of the components required for person-centered options counseling in New Hampshire. For more information about the certification process, please refer to the New Hampshire No Wrong Door Person-Centered Options Counseling Certification Booklet and the No Wrong Door Competency Framework. Thank you and have a great day.